I'm going to open the line up for questions.
Hi. First of all, I want to say congratulations to all of you. I think this is awesome. I'm late to the game. I am a physical therapist. I've been a physical therapist for 20 years, and I'm also a home care provider for therapy and a director of rehab. So I am very interested in the product and getting to learn how to become certified and all that stuff. So I just didn't know where I needed to start on that end, and then how to go about kind of getting some of the products as well, so that I know what I'm selling, what I'm talking about.
Absolutely. So we're excited because here at Wakana, we really value education. You know, education is key. I recommend that you get back with the person who invited you to our group. You get your product. I recommend that you come in with a full dispensary, because a full dispensary will allow you to have the certification. In fact, you'll get 2 certifications for a lot you can use, and you can share with someone else. You'll get a full line of our product, and then you can immediately, as soon as you purchase that full dispensary, you can do the certification that we just completed last weekend. You can take the exam, you can get your certificate, you will then be able to really honestly feel comfortable about using and sharing the products with your family and your patients. And I think it's just a great program, because so many companies that offer CBD oil don't offer the education. And education is key, because what you'll find is that you'll find people that you'll run into and they'll say, that CBD doesn't work. Well, it's probably because they didn't get the right dosage. They were probably way too low, and they didn't get the effects it's for. So truly it is an experimental thing that you have to find that sweet spot. And in my practice, I start patients low, and I start low, because you don't want someone to start too high and they're like, oh my God, this is horrible. I have I'm nauseated. I feel horrible. You know, you want to make sure that they start low and start slow, so that you can get an amazing result for that person that they're looking for. And then there's so many options now that we have this water soluble. I mean, there's people who honestly don't like putting things underneath their tongue. No problem. Put it in your food. Put it in your water. Again, use the dosing chart, or you can use the recommended dosing on the bottle, or you can do microdosing. So there's so many ways that you can do the dosing. Let's not complicate this, guys. Don't make it complicated. It's not hard. Use 1 or 2 drops at a time, and you can increase that over 3 to 4 days, or you can simply follow the directions on the bottle, okay? If it is something that is in the 80s, we're talking about our elderly, don't start them out with 30 drops a day. That's way too much, okay? Start them off slow, start them off low. So we are excited to have you. The more you're educated about the product, the more you'll feel comfortable. And guess what? Your clients will really appreciate that you have taken that extra time to understand how this product works, how the dosing is formulated, and really they will appreciate that. And that's what sets us apart from all other companies that are out there. We really value education. We're serious about empowering each and every one of you about how to use this product effectively.
Well, congratulations again, and I am definitely going to do this and try to get started as soon as I can. And I look forward to hearing from you ladies again. And just thanks for doing the work. You know, I appreciate it. And let's go for it. Let's do this.
go. Yes.
Let's do this.
Yes. If there's any other questions, you can unmute yourself.
Hello.
Hi, Lala. How are you? Is that Lala?
Yes, it is.
Okay. How are you?
Hi, Wakanda Nation. Okay, so I do have a question in regards to using multiple products at the same time. So, like, if somebody is using the cream, the pain relief topicals, and they are using the tincture, is that too much? The other thing I wanted to ask is about taking the products on a plane.
Okay. So let's address the first question. The first question is using multiple products. The great thing about the topical is that the topical is a power product. That means it contains 0.3% or less of THC. When you use topical products, they don't pass the blood-brain barrier, meaning that they are not able to pass into the brain. So with the topical, what you're getting is topically, just that, to that area of concentration. For example, I overdid it with the weights, and so my biceps were really sore today. So I used the topical cream, as well as I used the water soluble in my bottled water today. What you're doing is you're getting the relief in the area that is causing pain, inflammation, as well as when you use a water soluble or tincture, which is absolutely fine to do both at the same time. You're getting the product in the bloodstream, which is different from using the product and getting the product topically on an area that is affected with pain that you need relief from. So using the topical with the tincture or water soluble is absolutely fine. It's not too much. Using topically doesn't pass the blood-brain barrier, so you're actually local relief that you need on any part of your body that you're looking for relief from. You can even use the tincture underneath your tongue and the water soluble. You may be in an area where you are at lunch or at a dinner and you want to add it to your food, and that's perfectly fine. Each drop is 1.67 milligrams, or if you're using the nano water soluble, that's 7.4 milligrams. And what's so good about really remembering 1.67 versus 7.4 is that you can actually calculate the total dosage that you're looking to consume in one day, okay? So if you're looking to consume, let's say 25 milligrams of a daily dose, then you know that maybe 2 drops of that 7.4, you're already at 14, and several more drops of the 1.67 will get you to 25 milligrams. So to dose out how many milligrams you want on a daily dose, you can actually target the amount based on that chart that I shared with you, that chart that has the severity of the medical condition and it has the person's weight. You can actually go to that chart and say, you know what, I've got severe pain, I'm 160 pounds, 27 milligrams is what I need on a daily dose. Now, the second part is carrying it on a plane. So carrying it on a plane, you want to make sure that you are using the protocol of TSA, making sure that it's in a Ziploc bag or whatever you need to have it in these days, or in containers. The gummies, again, you can put out bags. I've been to Africa, Bermuda, Bahamas, Jamaica, pretty much in all 50 states, and I've traveled with no issues with my product. I would definitely check some of the laws with TSA and ensure that you don't have too many liquids when you're doing it through a carry-on versus packing it in your suitcase. I think there was something on the news where a grandma was arrested or something in Disney World. So, there's still very unclear laws in some states, but in 2018, Trump signed that hemp is legal in all 50 states. So I would definitely make sure that you're following the protocol with your liquid. And if you are, again, using the other edibles like the gummies, I would make sure that, everything is in Ziploc bags if you're doing carry-on. And then if you are, checking those bags, that you just pack as usual. Did I answer your question, Lala?
Yes, you did. Yes, you did. Okay, I have one more. How would you discuss the vape cartridge with a person who is a consistent marijuana smoker and they're maybe confused, or they're looking for the vape cartridge to be like a supplement? I had that situation, so I'm just curious.
So you have a person that is using THC and they're smoking it, and they're wanting to use our cartridge for daily consumption.
For their enjoyment.
Okay. So a person that is smoking THC is definitely going to get a totally different experience when they use our vape pens. Our vape pens don't have the amount of THC that is found in products that are THC. So THC or marijuana strains will give you a percentage between upwards of 10% or more of THC. Our product has 0.3%, right? Very low, negligible amount. So what they're going to experience is all the benefits of CBD without the high. So they're going to be calm. They're going to be anxiety-free. They're going to be mellow. They're going to have reduction in pain and inflammation. They're going to get a great night's sleep, but without the high. So I have seen in my experience people who have smoked marijuana for years, when they start using CBD products, their cravings or desire for THC diminishes. Why? Because CBD is an antagonist to THC. It actually blocks the THC euphoria, and it gives that person all of the benefits that CBD has: anti-inflammatory, anti-anxiety, analgesia, helping with the mood, helping with sleep, all the receptors that we talk about that the endocannabinoid system has, they're going to see that. But it definitely will block their high. A lot of THC users will come to you and buy CBD because a lot of THC users use CBD to block their high or to bring their high down. So if they take too much of their THC, they actually use our product to bring them down. So it's a great marketing tool for those who are THC users, right? They use our CBD to really bring that THC effect way down when they take too much. Does that answer your question?
Oh, okay, yeah. I was saying, great. That really makes a lot of sense. I did tell him the other day that you really should be calm because he said he was really trying to get high, and he used the entire cartridge. And so
you won't get high. You won't get
that's
high.
what I told him.
Yeah.
That's what I told him. I said, but you should be real nice and calm right now.
Right. You should be real nice and calm. But if somebody is buying our products to get high, then they're at the wrong place. So if someone is wanting relief of inflammation and pain and anxiety and insomnia and all the other conditions that we see CBD assists with, glaucoma, psoriasis, kidney, liver, lung, teeth, seizure disorders, convulsions, that long list of conditions that we know CBD assists with, they're in the right place. So if they're trying to get high, then they need to, go elsewhere. You will not get high on our products.
Exactly. Yeah, that's what I told them. Since you just went down the laundry list, I have another question in terms of branding and advertisement and promoting in our variation of ways that we're able to. Is it best to not, like you just named the list of areas that CBD is known to be a resource and a comfort? Is it best to not get into naming them? Because I've been very general with how I've been explaining.
It's good to be general, and it's always good to remind people that you cannot diagnose, make any claims of cure. All you can do is share with them the research that is easily accessible on the Google or any of your favorite search engines. And you can also, share with them if you have a personal story or if you have a story of someone that is near and dear to you that has gotten relief from the product. But absolutely, the FDA does not allow us any claims to diagnose. You are not on the line. I'm a physician, but I'm not anyone in Wakana's doctor. So you can't call me and use me as a person's physician. I'm not their physician. We recommend that if patients and clients and consumers are on multiple medications, if they're under a doctor's care, they really should let their physician know that they want to start using this oil. And they can go to their physician with our brochures. They can go to their physicians with articles. I know there is one sales affiliate I spoke to today in Texas, and I actually helped her client get some articles that when she sees her physician this week, that she can take her physician's article, because most physicians have never had any experience with CBD. A lot of them have never heard of CBD. And quite honestly, a lot of them are closed-minded. So you have to go with them with information that is, a lot of it's anecdotal, but there's over 22,000 peer-reviewed articles on CBD. There's a lot of information out there. And they just have to be willing and open-minded that, you want to try something that is safe, that is organic, that will assist you in getting off of so many medications, and quite honestly, something that's going to finally work to address your pain and inflammation or any other conditions that you're looking for this oil to help you with. So it's all about education. It's all about really being empowered with this information so you can take it to your physician or healthcare professionals. And you just have to pray that your physician is someone like I was. 2 years ago, I never heard of CBD. And instead of telling Melissa Boston absolutely no, I went and did my due diligence. I did my research. And when I did that and found out all of the medicinal properties that CBD had, I was sold. And so that's what I recommend that we do, and we continue to help people get on the other side of knowledge. You know, invite your physician on a call, on a Wednesday night call. Invite your physician to engage. That's what my recommendation is. Any other questions before we close it out? Well, great. If there's no other questions, I would invite all of you to seriously get back with the person that invited you, whoever invited you tonight. I would hang up and call them immediately. Order products, order your full dispensary, order your personal dispensary. By ordering a micro dispensary, it's a great way to get a percentage in a discount versus buying it retail, buying it in a larger amount as a full dispensary or a personal dispensary. You definitely get more bang for your buck. With the full dispensary, you get the education through Wakana University. You get an opportunity to not only use the products personally, but share and to sell the products to others. I want to thank you again for your patience, but if you have any questions, you can email me at drritamac@yahoo.com. That's DR, D as in David, R as in red, then my first name, Rita, R-I-T-A, M as in Mary, A as in Apple, C as in cat, @yahoo.com. Of course, whoever invited you on this call is going to get you plugged in on our Facebook page, Wakana for Life. They're going to get you plugged into all of our calls, all of our meetings, as well as our local meeting, which is every Thursday at 7 p.m. at 10615 South Hofstad in Chicago, and every Saturday morning at 10 a.m., again, 10615 South Hofstad in Chicago. So have an amazing rest of your night. Have an amazing night. Good night. And we will see each and every one of you soon. Don't forget to hang up and to call the person who invited you so we can get you started. And welcome to Wakana Nation.